Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. This is part 2 of the 2-part nutrition and immunity series. In part 1, I explained common ways in which our immune system becomes weakened, leaving us susceptible to respiratory tract viral and other infections. I also explained the research showing that there's an impact of certain vitamins, minerals, and herbal agents like astragalus, medicinal mushrooms, milk thistle, and the indole 3 carbinol, which can help to support our immune system function from day to day. Now, in this part 2 video, I want to touch on 3 other nutrients showing promise in supporting immune system function, especially with respect to viral-induced respiratory tract infections. Now, these include vitamin D, probiotics, and melatonin. Melatonin for those over the age of 40 or 45 years old. So let's start with vitamin D. An excellent review of how vitamin D works to strengthen the immune system against acute respiratory tract infections was published in the journal Infectious Diseases in 2010. The researchers performed a placebo-controlled double-blind study involving 164 young Finnish men aged 18 to 24 years of age undergoing compulsory periodic military training. They showed that the men who were given 400 IUs of vitamin D per day during the 6-month training had significantly fewer respiratory tract infections and related fewer days of absenteeism from training compared to the recruits who ingested the placebo. Now, there have been a number of vitamin D intervention trials like this using vitamin D dosages as high as 4,000 IUs a day. Now, some studies have shown a protective effect against respiratory tract infections, and some have not. What seems to be a fairly consistent finding is that individuals who have a blood vitamin D level above 80 nanomoles per liter show greater resistance to upper respiratory tract infections than those who have blood levels that are lower, especially if their blood level is below 25 nanomoles per liter, which really seems to increase risk. In this published paper, the researchers explained a novel way in which vitamin D affects immunity with respect to the prevention of respiratory tract infections specifically. They explain that immune cells that line the respiratory tract have vitamin D receptors, which allows the vitamin D to enter into the immune cells. And once inside the immune cell, vitamin D is converted to a more potent form of vitamin D, and then it gets transported right to the nucleus of the cell where the DNA is. And within the cell nucleus, the vitamin D modulates specific genes involved in immunity. Now, one of these gene effects is that vitamin D increases the secretion of a virus-killing molecule known as cathelicidin. And as immune cells interact with various microbes, including viruses in the respiratory tract, cathelicidin punctures a hole in the viral or bacterial membrane, destroying the invader and thus preventing infection. As such, lower vitamin D blood levels result in lower secretions of cathelicidin, which resulting in reduced antiviral fighting abilities of the immune cells that line the respiratory tract. So it's always a good idea to know your vitamin D blood level and to put into place supplementation practices, if necessary, to get your vitamin D blood level above 80 nanomoles per liter without exceeding 150 nanomoles per liter. So, and sometimes blood panels will come back and it will list vitamin D in nanograms per milliliter. In those cases, you want the value to be between 32 and 60 nanograms per milliliter. Most people can achieve this with about the intake of 600 to 2,000 IUs of vitamin D per day from supplementation if necessary. Now, some people need to be extra cautious with vitamin D supplements. These individuals include those with active tuberculosis, individuals with sarcoidosis, which is an autoimmune condition, people with lymphoma, and primary hyperparathyroidism. In each of these cases, the body is often synthesizing very high amounts of vitamin D as a result of the disease. Taking additional vitamin D can easily cause vitamin D toxicity in these cases, where vitamin D blood levels would go above 250 nanomoles per liter or 100 nanograms per milliliter. So first, know your blood vitamin D level, and if it's below 80 nanomoles per liter or 32 nanograms per milliliter, then consider vitamin D supplementation to get into the more ideal or optimal range, which is between 80 and 150 nanomoles per liter or 32 to 60 nanograms per milliliter. This is something to strongly consider, in my view, for a host of reasons, as vitamin D in the optimal range also helps support bone density, cardiovascular health, and may be important in the prevention of some cancers as well as type 1 diabetes. Okay, let's talk about probiotics as the second topic here. According to the World Health Organization, probiotics are live microorganisms that, when administered in adequate amounts, confer a health benefit on the host meaning our human cells. So more specifically, probiotics are live microorganisms. They're specific strains of friendly bacteria and yeast that may improve health by bolstering local and systemic immunity. That means immunity throughout the entire body when we talk about systemic immunity. Their mechanism of action is thought to occur through enhanced phagocytic capacity and activity, stimulation of higher levels of specific immunoglobulins, and enhancement of gut barrier functions. So this means that probiotics have been shown to boost the ability of certain immune cells to identify, engulf, and destroy many types of pathogens, including viruses that cause respiratory tract infections. It also means that probiotics have increased the levels of immunoglobulin A, which is a key antibody that protects the respiratory passages and the intestinal tract against infectious agents, including viruses. As outlined in a review paper in the journal Current Opinion in Gastroenterology, probiotics showed therapeutic potential for diseases including several immune response-related diseases such as allergy, eczema, viral infection, and potentiating vaccination responses. End of quote. This means that probiotic supplements have in many cases toned down allergic sensitivities, improved cases of eczema, a skin condition often triggered by food or environmental allergies, intolerances, or sensitivities, reduced viral infections, as we will discuss, and improves the efficacy of certain vaccinations, including the influenza vaccine. That means someone getting the influenza vaccine, if they also take probiotics, the vaccine works more optimally. The researchers cite the studies showing that probiotics regulate our innate and adaptive immune responses by modulating the functions of dendritic cells, macrophages, and T and B lymphocytes. It's the dendritic cells and the macrophage immune cells that identify and gobble up viruses that are trying to invade our body, and our T and B lymphocytes mount an antibody attack against viruses that are trying to infect us. So the type of immune modulation we get from probiotic supplements may be an important consideration in optimizing immune function from day to day. With respect to probiotics and upper respiratory tract infections, the Cochrane review of 12 trials were included in a recent meta-analysis, and data from almost 4,000 participants in randomized control studies conducted between the years 2002 and 2013 involving 8 different countries were analyzed. The researchers concluded the following, and I quote, "Probiotics were found to be more effective than placebo, reducing the number of participants who experienced episodes of acute upper respiratory tract infections by 47%, and the duration of an episode by about 1.89 days. Probiotics also slightly reduced antibiotic use and cold-related school absences. In older adults, although probiotics did not reduce the rate of upper respiratory tract infections, the duration of the infection was decreased. And subgroup analysis of all age groups suggests that probiotics reduce the number of children experiencing acute upper respiratory tract infections. Overall, probiotics were found to be safe with few adverse side effects, mostly just some gastrointestinal upset." End of quote. So these studies included a variety of different probiotic combinations, and thus it's difficult to know what combination of live bacteria and yeast are the most ideal. In fact, no one really knows at this point what the most ideal probiotic combination should be. But in the text below, I've included the various lactobacillus, bifidus, and streptococcal bacterial strains that show impressive probiotic results, along with the yeast species Saccharomyces cerevisiae. So I've included that list so you can see what are the best sort of gut-friendly bacteria to consider. So you may want to take a probiotic supplement each day containing a good mixture of the impressive probiotic species that I've outlined in a form that delivers 2 to 10 billion living organisms per day. Okay, nutrient number 3, melatonin. I want to touch on the hormone melatonin. Melatonin is a hormone made by the pineal gland in the brain, but some immune cells also synthesize it. Now, as we age, melatonin secretion declines, and this decline appears to be part of the reason that our immune function also declines in the aging process, a condition known as immunosenescence. Studies show that the T lymphocyte known as the CD4 cell, also known as the T helper cell, which is really the quarterback of the entire immune system, has melatonin receptors. And with the decline in melatonin levels in aging, there's less CD4 cell modulation by melatonin, and the immune system becomes weaker and less efficient. Experimental studies show that many immune parameters improve to more youthful function when melatonin is administered to aging animals. And we think the same is also true in humans. In fact, many rheumatologists recognize that melatonin supplementation can increase the strength of the immune system in humans, and thus they caution their autoimmune patients about using melatonin supplements as it may exacerbate their autoimmune condition, such as rheumatoid arthritis or lupus. As well, patients who have severe allergies, lymphoma, or transplant patients on immune suppressant drugs are often cautioned by their doctor about taking melatonin supplements because of its potential to heighten immune system activity. But for otherwise healthy adults over the age of 40, when melatonin levels are substantially lower, it may be wise to consider low-dose melatonin supplementation 1 hour before bedtime as an adjunctive strategy to support and strengthen immune system function. Large human intervention trials using melatonin for this purpose are still lacking, but preclinical studies are very impressive, showing positive effects on reversing many aspects of the aging process on the immune system. Remember that as you get older, your body makes less and less melatonin, and thus higher and higher dosages may be required the older you get. So here are some guidelines to consider if melatonin is sort of on your list of things you might want to pursue. If you're between the age of 40 and 50, you might want to consider 1 hour before bedtime a dose of 500 micrograms to 1 milligram. Age 50 to 65, maybe 1 to 2 milligrams an hour before bedtime. If you're over the age of 65, you might want to be taking 1 to 3 milligrams per day. Note that if you wake up groggy the next day, the melatonin dosage you're taking is likely too high. So start with a lower dosage and gradually increase it to find which dosage helps to give you a good night's sleep without zapping your energy the next day. Now, one final note is that studies suggest that the consumption of too much refined sugar can also suppress immune function for many hours after its ingestion. This is one of the reasons that diabetics are immune compromised. Higher blood sugar levels inhibit the ability of immune cells to secrete antimicrobial agents such as beta defensins, which many immune cells use to burst a hole through the outer skin or membrane of a virus trying to invade the respiratory tract and other body surfaces. So keep your blood sugar in the ideal range so your immune cells can generate this important antiviral, antibacterial, antifungal agent, and also maintain their ability to trap and devour various threatening microbes. So I've included the references for all of this information in the text below. I hope you found it to be helpful. Thanks for watching, and I'll see you next time.